Introduction. Allergic reactions are considered multifactor, heterogeneous disorder caused by an interaction of the environmental and genetic factor can express themselves in many different organs. Recording Europe Academy of the Allergy and Clinical Immunology (EAACI), allergic hypersensitivity may be classified into as IgE mediated or not IgE mediated, the latter being associated with a specific T cell response as in a contact dermatitis. IgE mediated remission is associated with atopy, different as a personal or familial tendency to produce IgE antibody in the respondent to low dose of allergens, usually protein, and to develop typical symptoms such as asthma or eczema or dermatitis. An allergy occurs when a person's immune system reacts to the substances in the environment that are harmless to the most people. These substances are known as allergens and they are found in the dust mites, pets, pollen, insect, food, and some medicine. Next, atopy is the genetic tendency to develop allergic disease. When atopic people are exposed to the allergen, they can develop an immune reaction that leads to the allergic inflammation. Allergic disease results from an interaction between individual genetic susceptibility and exposed to environmental factor. Factor of environment is climate, air pollution, airborne allergy, and food allergy. Environment factor in the combination with the genetic prevention of the patient may contribute to the development of so-called inherited form of the asthma or atopic dermatitis, which are accommodated by sensitization to environmental factor and the presence of the antigen-specific serum IgE. Genetic of the contact allergy is still only partially understood. Depends decided of the research, which might be due to intellectually different phenotype used in the past. Susceptibility to contact allergy may be influenced by the genetically determined alterations in the production of the pro- and anti-inflammatory cytokines, influenced by the variable habits present in the surrounding environment, including the accumulation bias.
Do you guys wonder why are allergies limited to some people? Although scientists have a good understanding of how allergy responses happen, it is still unknown why some people acquire allergies and others do not. There is a hereditary propensity for allergies, which means that if your mother or father have them, you are more likely to as well. For instance, people may develop allergies to things like pollen, medicines, animal hair, eggs, and milk. In relation to an allergen in the air, such as pollen, the person will exhibit symptoms including eyes that are swollen, red, and itchy for an allergic person. How does an allergic response happen? One of the key participants in allergic responses, mast cells, collect and show immunoglobulin type E, which is IgE, a specific form of antibody that binds to allergens. Granules or little chemical filled containers are found inside mast cells. Histamine is one of the strong compounds found in granules. Immunologists distinguish between two main categories of allergic reaction, which is immediate hypersensitivity reaction, which are typically mast cell mediated and take place minutes after contact with the allergen, and delayed hypersensitivity reaction, which are T cell mediated and take place hours to days after exposure. Most allergens that are inhaled or consumed immediately result in hypersensitive responses. Mast cells release the contents of their granules onto nearby cells such as blood vessels and nerve cells onto allergen attached to IgE antibodies on their surface. Histamine receptors are unique proteins that help histamine attach to the surfaces of these other cells. Histamine interacts with blood vessel receptors to promote lichens, which results in fluid accumulation, oedema, and heightened redness. Additionally, histamine increases pain receptors, increasing tissue sensitivity and irritability. In the hours that follow contact, symptoms might linger for many hours. Common allergy, such as runny nose and itchy, bloodshot eyes, are caused by acute hypersensitivity responses in the upper airways and eyes. These responses cause the intestinal lining to expand and irritate in the gastrointestinal system, which results in the cramps and diarrhea that are typical of food allergies. Hives, angioedema, anaphylaxis, or atopic dermatitis can all be brought on by allergens that into the bloodstream. Skin allergens often result in a delayed hypersensitivity response. A longer-lasting immune response is triggered by when roving T cells come into touch with the allergen. Following contact with the allergen, this sort of allergy reaction may take several days to develop, and symptoms may last a week or more. Do you guys know that the doctor will be able to help a patient determine what is causing the response if they think they could have an allergy? Blood tests are one type of allergy test. They assess the immune system IgE antibody levels to certain allergens. Afterwards, skin prick testing. A little quantity of a potential allergy will be pricked into the skin by a physician. A person may develop an allergy if they have a reaction in the form of itchy, red, or swollen skin. Test patches. The back of the patient may have a metal disc with a tiny quantity of a suspected allergen tape to it by a doctor to test for contact eczema. They will examine for a skin response again 48 hours and 2 days later.
Next, if we were exposed to the causes of the allergies that were mentioned before, there will be an allergic reaction that will show after that. These allergic reactions can cause mild to severe symptoms. When you are first exposed to an allergen, your symptoms may be modest, but if you are regularly exposed to the allergen, your symptoms may be worsened. As I was mentioned before, there are two types of reaction, which are mild reaction and severe reaction. So I will show what the example of the signs of symptoms that will be react after the exposure. Symptoms of a mild allergic reaction are hives or itchy red spots on the skin, rash, itching, allergic rhinitis, which may lead to symptoms such as nasal congestion or sneezing, scratchy throat, and watery or itchy eyes. These mild reactions are harmless to the human health. For the severe allergic reactions, usually allergic to foods, insect stings, and medications, can cause abdominal cramping or pain, diarrhea, nausea or vomiting, pain or tightness in the chest, difficulty swallowing, difficulty breathing, wheezing, fear or anxiety, heart palpitations, flushing of the face, swelling of the face, eyes or tongue, dizziness or vertigo, weakness, and unconsciousness. These allergic reactions can affect the human health. Alright, next, hay fever, which is also called allergic rhinitis, is the allergic reaction to pollen that can cause cold-like symptoms. For example, sneezing, itching of the nose, eyes or roof of the mouth, runny and stuffy nose, also watering, red or swollen eyes. A food allergy is when we eating certain food that will cause tingling in the mouth, swelling of the lips, tongue, face or throat, hive, and anaphylaxis. An insect sting allergy can cause a large area of swelling, which is edema, at the sting site, itching or hive all over the body, cough, chest tightness, wheezing or shortness of breath, and also anaphylaxis. There are also a drug allergy which can cause hive, itchy skin, rash, facial swelling, wheezing, and also anaphylaxis. Atopic dermatitis is an allergic skin condition, also called eczema, which can cause the skin to itch, redden, and flake or peel. And lastly, some allergies such as food allergies and insect sting allergies can cause a severe reaction known as anaphylaxis. Anaphylaxis is a potential fatal medical emergency that can cause shock. Signs and symptoms of anaphylaxis include loss of consciousness, a drop in blood pressure, severe shortness of breath, skin rash, lightheadedness, a rapid or weak pulse, and nausea and vomiting.
Next is allergy treatment. First, allergen avoidance. Your provider will help you take steps to identify and avoid your allergy triggers. This is generally the most important step in preventing allergic reaction and reducing symptoms. Second is medication. Depending on your allergy, medication can help reduce your immune system reaction and its symptoms. Your provider might suggest non-prescription or prescription medication in the form of pills or liquid, nasal sprays or eye drop. Third is immunotherapy. For severe allergies of allergies not completely relieved by other treatment, your provider might recommend allergen immunotherapy. This treatment involves a series of injections of purified allergen 3 and track usually given over a period of a few years. Another form of immunotherapy is a tablet that's placed under the tongue until it dissolves. Lastly is emergency epinephrine. If you have a severe allergy, you might need to carry an emergency epinephrine shot at all times. Given for severe allergic reaction, an epinephrine can reduce symptoms until you get emergency treatment. Next is allergy prevention. Allergy prevention involves taking steps to minimize exposure to allergen and reduce risk of allergic reaction. Here are some general strategies for allergy prevention. Okay, first, identify your allergen. Determine which substance or triggers cause your allergy. Common allergies include pollen, dust mite, pet dander, moth spores, certain food, and insect venom. Second is avoid allergen exposure. Once you know your allergen, take measures to minimize your exposure to them. For example, pollen. Stay indoors on high pollen days, keep windows closed, use air purifier, and avoid outdoor activities during peak pollen time. Next is dust mite. Use dust mite-proof cover on pillows and mattress. Wash bedding regularly in hot water. Vacuum carpet frequently and reduce humidity in the home. Next is pet dander. If you are allergic to pets, keep them out of your living space or at least out of your bedroom. Regularly groom and wash your pet to minimize dander. Okay, second is maintain a clean living environment. Regularly clean your living space to reduce allergen. Vacuum carpet, dust surface with a damp cloth, and wash bedding and curtain regularly. Use a high efficiency particular air HEPA filters in vacuum cleaners and air purifiers to trap allergen. Fourth is practice good hygiene. Wash your hands frequently, especially after coming into contact with potential allergen like spat, pollen, and dust. Avoid touching your face, particularly your eyes and nose, as this can transfer allergen and cause irritation. Fifth is be cautious with food allergy. If you have food allergies, read food labels carefully and ask about ingredients when eating out. Inform restaurant staff about your allergy to prevent cross-contamination. Carry emergency medication such as an epinephrine auto-injector if prescribed by your doctor. Okay, lastly is manage indoor air quality. Keep indoor air clean by using high-quality air filters in your home's system. Ensure proper ventilation in the kitchen to prevent cooking-related allergens. Avoid using strong chemical, perfume, or aerosol spray that can trigger allergy.